Imagine a traffic jam, not on the highway, but inside your own blood vessels. That's what happens with an arteriovenous fistula, or AVF. In simple terms, it's an abnormal connection between an artery and a vein. Now, picture this happening in the upper part of your neck, near your brain. That's an upper cervical AVF, a complex condition that has puzzled doctors for years. These fistulas can cause a range of symptoms, from annoying pulsating sounds to serious neurological problems. What makes them particularly intriguing is their unpredictable nature. For a long time, we believed that these AVFs were primarily caused by injuries, like a blow to the head. However, recent discoveries have challenged this assumption, revealing a much more complex picture than we initially thought. We are now beginning to understand that some of these fistulas form spontaneously, without any obvious external cause. This has opened up a whole new avenue of research, leading to surprising findings and challenging our previous understanding of these unusual vascular anomalies. To understand AVFs, we need to understand the basics of our circulatory system. Arteries are like the highways of our body, carrying oxygen-rich blood away from the heart. Veins, on the other hand, are the return routes carrying deoxygenated blood back to the heart. Normally, these two types of blood vessels are separated by a network of tiny capillaries where the exchange of oxygen and nutrients takes place. An AVF disrupts this orderly flow. When an abnormal connection forms between an artery and a vein, blood bypasses the capillaries and flows directly from the high-pressure artery into the low-pressure vein. This can lead to a number of problems. The affected vein, now bombarded with high-pressure arterial blood, can become enlarged and distorted. This can cause swelling, pain, and a noticeable pulsation near the fistula. In some cases, it can even lead to heart problems if the heart has to work harder to compensate for the altered blood flow. Historically, trauma was considered the leading cause of AVFs, especially in the upper cervical region. A sudden blow to the head or neck, such as from a car accident or a sports injury, could damage the blood vessels, creating a pathway for the fistula to form. This made intuitive sense, and indeed many cases of AVFs were linked to such traumatic events. Similarly, medical procedures, particularly those involving the insertion of catheters into the blood vessels, were also recognized as potential causes of AVFs. This is known as an iatrogenic cause, meaning it's a complication resulting from medical treatment. While relatively rare, these iatrogenic AVFs highlighted the vulnerability of blood vessels to injury during invasive procedures. While the trauma link explained many AVF cases, it didn't explain them all. Doctors began to observe cases where patients developed AVFs without any history of injury or invasive procedures. These spontaneous AVFs, as they came to be known, presented a new puzzle. What could be causing these abnormal connections to form without any obvious external trigger? Advances in imaging technology, particularly the development of high-resolution CT scans and MRIs, played a crucial role in this discovery. These sophisticated imaging techniques allowed doctors to visualize blood vessels in intricate detail, revealing the presence of AVFs that might have gone unnoticed with older imaging methods. This led to a growing recognition that spontaneous AVFs were not as rare as previously thought. Section 5, the genetics puzzle. Are some people predisposed? The emergence of spontaneous AVFs prompted researchers to look for other underlying causes. This led them to investigate the role of genetic factors. Could there be certain genes that predispose individuals to developing these vascular anomalies? Research suggests that the answer is yes. Several genetic disorders have been linked to an increased risk of AVFs. These include conditions like neurofibromatosis type 1, a disorder that affects cell growth and can cause tumors to grow on nerves, hereditary hemorrhagic telangiectasia, a disorder that affects blood vessel formation, and Ehlers-Danlos syndrome, a group of disorders that affect connective tissues. While these genetic links don't explain all cases of spontaneous AVFs, they provide crucial clues into the complex interplay between genes and vascular development. Section 6, surprising twists, spontaneous resolution and OPLL connections. Just when we thought we were starting to unravel the mysteries of AVFs, a series of surprising findings added new layers of complexity. One of the most unexpected observations was the phenomenon of spontaneous resolution. In some cases, AVFs, particularly smaller ones, were found to close on their own without any treatment. This spontaneous resolution, while not common, challenged the notion that AVFs always require medical intervention. It also raised intriguing questions about the body's natural healing mechanisms and the factors that might influence the stability of these vascular connections. Another surprising discovery was the link between AVFs and a condition called ossification of the posterior longitudinal ligament, or OPLL. This condition involves the abnormal bone formation in a ligament that runs along the back of the spine. While the exact nature of the link is still being investigated, the association between these two seemingly disparate conditions hints at a shared underlying mechanism that we don't yet fully understand. Section 7. Navigating diagnosis and treatment in the age of discovery. The evolving understanding of AVFs, particularly the recognition of spontaneous cases and the potential role of genetics, has significant implications for diagnosis and management. Traditionally, the focus was on identifying trauma or iatrogenic causes. However, with the awareness of spontaneous AVFs, doctors now need to consider a broader range of possibilities, even in the absence of a clear external trigger. Genetic testing is also becoming increasingly important, particularly in cases where there is a family history of AVFs or related conditions. Identifying genetic predispositions can help with early detection and may influence treatment decisions. Treatment for AVFs varies depending on the size and location of the fistula, as well as the severity of symptoms. In some cases, careful observation may be sufficient, especially for small, asymptomatic fistulas. For larger or symptomatic AVFs, treatment options include minimally invasive procedures like embolization, where the fistula is closed off from the inside using coils or other materials, or surgery to repair the abnormal connection. Section 8. The road ahead, research and hope for the future. The world of upper cervical AVFs is a rapidly evolving field. We've come a long way from attributing these vascular anomalies solely to trauma. The discovery of spontaneous AVFs, the increasing recognition of genetic links, and the observation of surprising phenomena like spontaneous resolution have opened up exciting new avenues for research. As we delve deeper into the intricate workings of these fistulas, we're gaining a better understanding of their underlying causes, natural history, and potential treatment options. This ongoing research holds the promise of developing more effective and targeted therapies, improving the lives of patients living with these complex vascular conditions.